take roll call. Renee, thoughts on that?
Yeah,
Just
give her
Jen's
just
on the
1
phone.
minute. She might be working with Commissioner
Yeah.
Herron.
I suspect that's what she's doing, yeah.
Yeah.
Jen's there. He's there.
Robert, how's the fire department doing, buddy?
Hang on a second. I had to unclick my mic there. Pretty good. We just brought on 5 new volunteers.
Oh, that's fantastic.
And we've got, I think we brought a total of 5 full-time career firefighters on too.
Gosh, wow.
That's pretty spectacular, really. 5
That's
volunteers. That's
Yeah.
That's great. Yeah, did they go to the academy too?
Let me think. The ones we brought on have gone to EMT school. So all of them
They're
have
already-
their EMT credentials, but we
Oh, that's
don't use volunteers anymore for firefighters. We just use them for medical.
Oh, that's fantastic. That's 80% plus of your calls, right?
Oh yeah.
80%.
Yeah.
Yeah, wow, that's fantastic, Robert. So they're doing night shifts too then?
Oh yeah. Night shifts and day shifts.
Yeah. Wow, that's fantastic.
Well, Commissioner Hogley, if you'd like to get started, since we're almost 5 minutes after, I can do roll call and Jen and Commissioner
Yep.
Herron can catch up. Does that sound okay?
I'm absolutely good
All
with
right.
that. Let's go for it. Thank you,
Okay.
Renee.
All right, let's do roll call. Commissioner Hogley.
Present.
All right, Commissioner Carter.
Present.
Great. Commissioner Spikers
here.
and Commissioner Norris.
I am here.
Great to have you, Daryl. Thank you.
And
And
let the
Commissioner
record-
Herron, I suspect, is still trying to sign on, so we'll
Yep.
hold roll call for her. And tonight you have myself and you've got CSO Moore. Dr. Moore is in the house. And we have Dr. Storm excused tonight and Trisha Ralstad's excused tonight, and CFO Ritter will likely be joining us later in the meeting, hopefully by the financial report. So, and then we've got several directors and managers joining us tonight, and community
See.
member Robert Agarsano.
Very good. It's
All
great
right.
to see everybody. Thank you very much, Renee. Okay, with that, I'll go ahead and ask for approval of the board meeting agenda. Can I have a motion to approve the board meeting agenda?
I move that we approve the agenda.
Thank you. Commissioner Carter, do I have a second?
I believe I'll be having a second on that. This
Thank
is
you, David.
Commissioner Spikers.
Very good. Thank you, Commissioner Spikers. Have a first and second. Go ahead and call for the vote. All in favor of approval of the board meeting agenda, please signify by saying aye.
Aye.
Hi.
Aye. Okay, let the record show that Commissioner Herron is still trying to work through the technical difficulties. Thank you very much. Motion carries. Next on the agenda is public comment. I'll go ahead and open the floor for public comment. Is there anyone here that would like to make a public comment? Anybody here that would like to make a public comment? And lastly, is there anybody here that would like to make a public comment? Okay, hearing none, I'll move on to the consent agenda. Looking for a motion to approve the consent agenda. Do I have a motion?
I'll move to approve the consent agenda.
Thank you, Commissioner Carter. Do I have a second?
I'll second that.
Thank you, Commissioner Spikers. Having a first and second, go ahead and call for the vote. All those in favor of the approval, motion's been made and seconded for the consent agenda. Please signify by saying aye.
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 Opposed? And
although we
abstaining?
didn't hear her, I did see Daryl's motion for yes, approved.
She did. Okay, very
She
good.
did.
And again, let the record show that Commissioner Herron is still working through the technical difficulties. Okay, thank you for everybody. Moving forward to our patient story. Renee?
All right, I am going to sit in for CNE Trisha Ralston tonight. She's on a well-deserved pre-scheduled vacation, but we have a fantastic patient story to share with you to kick off our board meeting.
Thank
So
you.
this patient story comes to us from the urgent care. And a patient's mother wrote to us and she says, "My daughter was seen at Snoqualmie Ridge Urgent Care this evening. I generally prefer to see our pediatrician when possible, but I was so impressed with Catherine Stanton at our visit. The receptionist was wonderfully kind and offered my 2-year-old a coloring page and some crayons while we waited. Catherine was attentive, and as soon as she walked in, she was able to diagnose my daughter with the flu and COVID and the start of an early ear infection. I felt very heard, which is not always the case with providers. She took the time to listen to what I had to say and formed a treatment plan with me for my daughter. She was receptive to my concerns and proactive in treatment. In the past at other facilities, I've felt that I really had to advocate for my children to get the care that they deserve. That was not the case tonight. In the best way possible. Having a sick kid is the worst, but I left feeling pretty good about the situation. I wanted to share that she did a great job and got us in and out quickly while still addressing every concern I had. She was amazing with my squirmy, sick 2-year-old. As a mom of a not quite talking toddler, being listened to with care and compassion is so important to me. I hope Catherine Stanton receives the recognition she deserves. This will definitely be our first stop going forward when we need to visit an urgent care facility." I really love that story. And as a mom with a now 13-year-old daughter, I know what it feels like to have a kid that's sick and can't express how they feel, and to be trying to advocate for your child and not being heard. And so it warmed my mom heart to know that we gave such great care to one of our community members and probably gained a patient for life. So very, very happy that this patient shared her story.
And thank you so much for bringing it forward, Renee.
You're welcome.
That is what it's all about.
It's exactly what it's all about. Yep.
So,
Thank you so much. Okay, moving on to our reports. First one up is the Quality Committee report. See any Ralston?
Yeah, so I guess I'm going to get a lot of reports tonight. Dr. Moore, please feel free to help me out and chime in anytime you'd like. But also, Commissioner Carter, I would invite you to have anything you want to add, as this was the quarterly quality meeting that both Commissioner Carter and Herron attended. And the report is in your packet. Also, within the consent agenda that you already approved, there was the annual quality improvement plan and the annual quality review summary. There is so much information in there, so I trust that you read it front to back and enjoyed what you had to read. But I think really the highlight of the quality committee report is just the high patient satisfaction scores, and just how our community continues to rate every single one of our departments the highest score possible. And we are unfortunately announcing the retirement of our quality improvement director, and so we will be doing a recruitment. I know we've had just a wonderful past year with Cecilia and her team. They've done a fantastic job. And so Trish will be doing a recruitment to find a replacement for her. Although it will be difficult to replace her, we will try to find somebody that is equally brings a lot of talent to our committee. And Commissioner Carter, what else would you like to add to our quality report tonight?
I loved how collaborative it was, how there was representation from every department. What a wonderful meeting. I was really happy to see that we had a member of the community that was there as well. You had representation from all over the hospital and all over the community and the board, and everyone had a voice, and it was a really great collaborative environment. And I love the positivity of it all, that we could always improve, and here's all the fantastic work we've done so far. It was really a highlight. Thank you for having me.
Yes, we loved it. The quarterly quality meetings are really going to focus on a recap of the work that happens in between. And so the commissioners will definitely get a lot of information and a lot of insight into a lot of the work that all the departments are doing. And Commissioner Carter, as you mentioned to me in follow-up, as we go forward, it's good to celebrate all of our wins, but we also do need to talk about the things where we need to do a little bit more work. And so we'll be focusing on making sure at those quarterly meetings that the commissioners get exposure to the areas where we have some growing edges and things that are being challenged. So,
Can I have a question on that?
sure,
Go ahead,
please, I
David.
would love one.
I always hear the quality of listened to quality reports for many years now. And I'm always curious because it just seems to me that we are kind of a leader in quality for the past several years now in the area. I'm not just talking the Snoqualmie Valley, but the Puget Sound area. And I'm wondering, as folks on that committee have had some kind of experience maybe with other facilities or other organizations, how do they rate our facility and the way we do things for quality? I mean, is our committee we know we're getting 95% satisfaction scores or 85, whatever the new standard is now. But I've always wondered, where are we at, with other people, how they view us, that kind of thing.
Yeah, so Commissioner Spikers, I think what you're asking is like, how do we benchmark some of those other things that we track? And some of the other things that we track and benchmark to other hospitals are hospital-acquired infections or patient falls or staff injuries. And so Commissioner Carter got to see the detailed dashboard on all of those and the benchmarks. And we honestly do an outstanding job at most of those. I would say probably the area where we have the most growth opportunity and where we probably are not the shining star is in our patient falls. I think there's room for improvement in our program there. But across the board, the metrics that are being traced with medication errors or lab errors or other things that we are tracking in all those other departments, we do quite well. And just like when we talk about rural hospitals, if you've seen one rural hospital, you've seen one rural hospital. Quality programs are very much the same. There's not one specific prescriptive standard way to do it. And so it's not like you can say, here's our quality committee, how does it rate to other organizations? It really comes down to those individual metrics that we track.
Yeah, it's very fascinating to me. We get an 85% satisfaction score. Traditionally, because of the makeup of our patients, we do have high numbers of falls, that, in certain areas, I think with our swing bed program. And I think that's always been the case just because we work with a lot of elderly people that really don't have very good balance. And they're always walking
that we have.
And they're walking out of bed when they're not supposed to. And that's been I don't know how you could fix that. Strap them down. You can't do that. But that's always been something. And I'm wondering, have we improved on that in the last few years?
We definitely have made improvements in that in the last couple of years. And more recently, I'd say probably the last 12 months have made some great progress. And there are new fall protocols, and we actually getting the new beds that have new bed alarms. There's all kinds of things that we've been putting into place, more frequent rounding, and it has made a difference. But as you pointed out and are very correct, with our high swing bed population, we do have a higher risk of fall. But I think we are making progress, and our goal is to have zero falls, obviously. But I think, like you said, the area where we could probably have the most improvement would be there.
Yeah, the last question, and I won't do this again probably, but this has been on my mind to ask, and this is a good time to ask. We also have we used to have some high incidence of UTI infections, and was kind of weird because we only had even if you had one, we had such a high score on that. It was just ridiculous. And the other thing is people come into the hospital with an infection already. And have we been able to improve on that at all?
Yes, I am very happy to report that our catheter-assisted infection rates have been almost non-existent. And one of the graphs that we showed at the quarterly meeting shows how many days of utilization we've had, and then zero infection rates with those. Our nursing staff is doing a fantastic job. So,
wow,
and then the
That's
hospital-acquired
really good.
infections, which are tracked separately, we've also had extremely low rates of those as well. So that's been doing very well.
Very
Oh,
good.
that's good to hear. That's been on my mind to ask, but this
Great.
is the proper time. So,
It is. I love it. Thank you for
So-
asking.
Yeah. Hey, just real quick, I just wanted to jump in and say a couple things. Number one, I want to say with regards to the quality committee, I had invited Jen to go ahead and sit on that committee. I stepped out of it and she jumped in, and I'm just thrilled to have her there with Commissioner Herron. And so I just really appreciate the two of you making the commitment that the two of you make. with regards to, that quality committee, and I always enjoyed it immensely. And everything you said, I would ditto, Jen, with regards to the meetings and how exciting they are. With that, I wanted to let the group know that I have, as I have done once before, when Commissioner Herron had an issue from a technical perspective, as we all do from time to time. And I have her here on the phone with us now. She's on my cell phone. I have her on speaker, so she can hear you now. So she's here. She doesn't have her packet, but she doesn't have obviously the visual, but she can hear us, everybody now, I believe. Is that right, Emma?
Yes.
Okay, very good. Hopefully
Great.
I have the volumes okay, suitable for you. And we can
Welcome,
go ahead.
Commissioner Herron. We will let the minutes reflect that you joined us at 5:15. We're glad that you could improvise and still make it to the meeting.
So, okie doke. On to our next item on the agenda on our reports is our CEO report.
All right.
Renee, you're up.
Thank you. I will also invite you to ask any questions, but I will just hit a few highlights for you. But please, if you have any questions, feel free to jump in. Very, very important reminder from Director Steve Wright. Our champagne brunch is right around the corner on May 2nd. Commissioner Herron, thank you so much for joining us and bringing some of your friends. If you guys haven't got seats, please, 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 if you can, join us. It's a wonderful event and definitely a worthy cause for our foundation. Let's see. All right, let's do, also the foundation sponsored, we called it a hub preview event and invited some of our local community members that are very interested in what's happening with the hub to join us to learn a little bit more about the hub and what we are doing and engage with us as we start on our journey to eventually do a bigger launch for our capital campaign. So thank you again to Director Steve Wright. We had a couple of just fabulously engaged community members, and Commissioner Herron was also able to help support that event and join us as well. So we really appreciate that. I'm not going to give you anything on the marketing update because we have Director Poss joining us later in our agenda, and so she'll be able to give that update to you herself. Our patient story, we talked about the urgent care, and we know just like emergency rooms, when you go to an urgent care, you're stressed, you're in need of help, and it can be a very difficult time to have to seek care. But this month, we had 100% positive feedback in March for our urgent care, which I just think is outstanding and really a shout out to the great work that team is doing there. So we've got some great providers, some great staff, and I think that it really makes an impact on our community and shows what we can do, and we really appreciate all of their hard work there for that. Also a shout out to Director Poss and Manager Will Pand. They presented at the Spokane Rural Health Conference and talked a bit about Snoqualmie's support of the what we called the Small Towns Big Fight. And this was sponsored by the Rural Health Collaborative to really improve screening rates for breast cancer across our rural communities. And although it doesn't seem like a lot, Snoqualmie went from 34.8% at the beginning of the campaign to 49.7%. So almost 50% of our patients that are due for screening were able to get it get in during this campaign. The reason why that is so remarkable is because we do not have a mammo yet. And so I just a shout out to the team. That was a group effort between Nicole and getting the word out through our marketing team and social media, but also to our clinic teams and actually calling patients and telling them that they are scheduled or needing to be scheduled, getting them scheduled, helping them connect with other local resources, or also leveraging our EMR and our MyChart application and reminding people to make those appointments. So thank you to Will and Nicole for representing Snoqualmie at the Regional Rural Health Conference, presenting our results. Also, the Finance Committee, I'm sure we'll talk about this, but I have to also mention that we were able to pay our strategic plan incentive compensation on this last payroll. And it is so heartwarming to be able to do this, where every single employee that has made a contribution to that plan and our success gets to be rewarded for that. We received several thank you notes and appreciation from our staff who said, just kind of in summary, we feel seen, we feel heard, and we feel appreciated for being a part of the organization's overall success. And so I just thank you to the commissioners for supporting this program and for helping us make sure that we can achieve our budget to be able to do that. And I'm just very thankful for an organization that appreciates that every single staff member is valued and that their contributions make a difference. So thank you for supporting that. Also, under kind of our engagement bucket with our staff and our people, a shout out to, we call it Snoqualmie Spirit. And this is a group of frontline staff members and a few of our leaders who are really engaging in making this the best place we've ever worked. And they are working on that strategic plan goal that says, have more fun. And we know everybody works hard and it's important to achieve great results, but it's also important to have fun doing that work. And it's important that we enjoy what we do every day. And so this team, most recently, they did a spring event and they had an entire conference room full of flower pots and paints. And you got to paint a flower pot and take home some seeds and just really welcome spring in to our community. It was very well attended. It was set up for both the day shift and night shift. And staff really, really enjoyed it. So I wanted to appreciate all the hard work that that committee has done. They are also the champions of Hospital Week, which is coming up starting May 12th. And in the back of my CEO report, I don't know if you can see this, there's a pretty little, maybe. Anyway, there's a schedule in there for you to see. I want to invite the commissioners to come join any of those events that you would like. We are doing things for both the day shift and the evening shift. Of note, I think the commissioners really enjoy the barbecue. That'll be on Wednesday, May 14th.
Thank you for the invite on that, Renee.
Yeah,
I'm pretty excited
please.
about it. It's just great. Thank you.
Yeah, we've got Chef Blake's team serving up the Hawaiian luau food, and so we are lovely. We'll do it out on the yard, out on the lawn, and I'm sure that the weather will bless us with some wonderful weather for that event. So please come join us. Also, under the people bucket, Commissioner Carter, I am so happy to tell you that we have got our volunteer program moving, and we have job descriptions. We are finishing up some of the training that we need to do with our staff to be able to have this happen. But we are starting to see, every week I do welcome notes for new staff, but that includes students and volunteers. And I'm starting to see some students and volunteers show up on that list. And we're doing some job shadows and some engagement. So great work to our HR team and also Anna from our marketing team for all of their hard work to make that happen. So I think there will not be a shortage of people that would like some opportunities. So we'll have to grow it as we can handle it, but it's nice to start to see some of those volunteers coming into the organization. Under community health needs, I think I mentioned a little bit maybe at the last board meeting, but it is worth mentioning again in case you're starting to see or hear some of the results of this work. But we have officially launched our SAFE program. And the SAFE program is Sexual Assault Forensic Examiner. And so any patient or community member that has experienced a traumatic event can come either make an appointment to be seen in the clinic, or they can come to our emergency room. Sometimes we receive these patients through either law enforcement or EMS. And we have a staff member who is leading this, who has freshly received her doctorate. So Dr. Catherine Thompson, and she is a wonderful leader and a great patient advocate and is leading this work. So there are not a lot of SAFE, or you may also hear them called SANE programs in the area. And so this is a huge community resource. I'm very proud of this work and thankful to Dr. Moore for supporting it as the executive sponsor and making sure that we can really do a good job for our community. Dr. Moore, I hate to put you on the spot, but I would also love to put you on the spot. And if there's anything else you'd like to share about this program.
No, you're not putting me on the spot at all. Just to resonate with what Renee said, Dr. Thompson, which we are thrilled to celebrate with her. She keeps about 10 balls in the air at all times, our Katie. So very proud of her. She is crazy, crazy proud of this work. She is passionate about it in every wonderful way that there is. And in fact, we've started to serve our community. So I always say that with a little bit of mixed feelings, because the fact is these exams are required and needed by our community, and we have started to conduct them, if you will. So Katie's done very well. She partners with our EMS fire, police, all of our partners out there in the community, and advocacy. So she has done a great job. We'll continue to ensure that this program is not only streamlined, but done in the best way possible for our community, like we would all care. So very proud of Katie, very proud of our partners who have partnered with us and gone along with us. Our ED under Abby Wallen's leadership as well. She was paramount to getting her staff up and running with Katie. And after one of our first examinations, Katie reported that ED staff did a phenomenal job. Everybody acted like they'd been doing it for a long, long time, and it went off very well. So proud of the team overall. And you can see Abby's comment. She said, happy to support the team, happy to support such an amazing program. And yes, Abby, thank you for your passion as well. It shows.
Thanks, Dr. Moore, and thank you, Abby, for also being instrumental in making sure that we can provide these services in the ED. We really appreciate that. All right. Our hub project is moving along. I think your executive team has more gray hair than we did last month as we work through this project, but it is a wonderful, wonderful project, and we are moving along with getting our bids or kind of our guaranteed maximum price underway. We're starting to get the information into the city. We attended the Snoqualmie City Review Board on Monday, and happy to report that we were approved by the review board. And so that is just another step forward. We are still working through negotiations with the mayor and also the city staff on kind of the fees and connections. So that is coming along. Tammy, anything else you want to add to that one as well?
So as part
you.
of oh, I'm sorry, go ahead.
No, go right ahead, Tammy. Forgive me.
So Renee, in terms of I think that we had some wonderful questions from the Planning Commission during that meeting regarding the project. But overall, I would say the resident feeling is one of support and excitement about the project, both in its creativity and innovation. But overall, I think the word you've heard a few times is ecosystem. This is going to be a place for community to gather. And I think that that resonates with, feels like most people that we've talked to. And so the Planning Commission went very well, and that was the theme overall.
The Planning Commission's job is to ensure that the exterior of the building is in line with the expectations of the community. Obviously, this will be a high profile for the city of Snoqualmie, as it's kind of the gateway or the entrance to the city. And so although we had fielded a lot of random questions about a lot of different things, but the Planning Commission's kind of scope and overview is really focused on what does the exterior of that building look like and what will the visual impact to the city of Snoqualmie be. Any questions, Kevin? It looked like you might have had one.
I was simply going to say thank you to yourself and Dr. Moore and the entire team that's been working with the city and all the work. It's a great project, obviously for us, but it certainly has a benefit to the city and all of the citizens within it, and obviously extending beyond that, obviously throughout the valley and our reach geographically. But thank you very much.
Great. All right, we'll keep hard at work at that. We are very, very close to having the land ready to close. We're just a couple more negotiations to happen there, and that we should be getting that done quickly. And we are on track for groundbreaking on May 23rd, May 25th-ish. So we're only a couple weeks later than we had hoped to be, but still well within our window of what we had expected. So we'll keep you posted. All right. Moving along, Dr. Storm was unable to attend tonight. We hope that he's feeling better, but I did get a quick update from him on our physician recruitment, and I really am excited to share that we signed Dr. Yoshida this week. Dr. Yoshida is orthopedic surgeon and specializes in hands. And so Dr. Yoshida will start on December 7th. So we're very, very excited. The North Bend expansion project is allowing us to bring this physician on early. Otherwise, we would have had to wait till the hub to open. This particular physician will see patients, do consults, do procedures, and all the sorts within the spaces that we have, and then will perform surgeries either at Overlake or Issaquah. So we are very, very excited and thankful for the recruitment efforts of Dr. Storm. We have a couple others, but they're not signed and I don't like to jinx it. So we're gonna wait on those and hopefully we'll have another update for you at our next board meeting on the rest of the physician recruitment. All right. Under financial stewardship, I wanted to have a shout out to the Association of Washington Public Hospital Districts. They are one of our biggest fans and have yet again come through in some financial support totaling $25,000 in grants for us. $10,000 that will be helping to support fundraising efforts for the hub, so that can be used for consultant fees or grant writing ventures that we might need to write some grants for. $10,000 to help support strategic planning and board education, and so this will be helping support the board's ability to do an off-site strategic planning retreat. And I think later in the agenda, Jen is going to jump in here and get some dates from you on dates that would work. And then last but not least, my favorite one, $5,000 towards equipment, which will help Chef Blake in his culinary program. And this will allow us to get a pizza oven at our current facility. And pizza is one of the things that Chef Blake has been trying to perfect, and it is phenomenal, but it also will be one of the cornerstones of the restaurant when we open the hub. And so this will allow us to engage with the community early and get the community very excited about that bigger pizza oven and restaurant coming when the hub opens. So we're very excited to support Chef Blake with a new pizza oven. So a reminder at the end of my report, I always try to keep the most important upcoming events in there. So take a look at that, mark your calendars, let us know if you have any questions. And then again, the hospital week schedule for the events that our Snoqualmie Spirit is planning is at the end of my report as well. Any other questions about the report or anything else you want to know more about? There's quite a bit in there.
It's packed full of just fantastic stuff, and it was an absolute joy reading it. And I know everybody's enjoying it. I'm excited about Hospital Week.
Great, fantastic. All right, Jen, would you like to? Oh, actually, it's later in the agenda. I was going to offer to let you bring up those dates, but we'll do it later. We'll do a strategic plan dashboard real quick. We've got foundational elements. Dr. Moore has been kind of taking lead on that North Bend clinic. We are coming along as scheduled. There's a lot of, it's kind of like the hurry up and wait period right now, but we'll start to see some action and kind of later in the summer there. We are doing fantastic on our visits and on schedule there to meet our goal. Financial stewardship is doing well. We had a great first quarter. By far, though, this does not mean we can let down our guard. And we did hear, on a positive note, that the SNAP or the safety net assessment monies will be flowing through to the hospitals. That was about a $1.2 million stressor in our budget, but it looks like that money will be flowing through, and that will be helpful for us making sure that we meet that target. Health system of choice, as I've reported in my report, doing very well. The patient satisfaction scores are amazing. Thank you to all of our team for all their hard efforts here. And for the first month in a really long time, we are not meeting our goal on our turnover rate. And so we are struggling there at 33%. And it looks like we need to update that title. So for this year, we had decided that we were going to do all turnover. So I will verify for you that this is all turnover, which is why we might be seeing that bump up a little bit. But it is the one area that I think we are going to be very challenged as we grow. That means we're hiring more and more new staff, and the more new staff we have, the more opportunities you have for people to leave within their first year. So I do think that this could be an area of vulnerability for us in our 5 goals. Any questions? All right, Commissioner Hovley.
It's hard. Sorry,
Go ahead.
it's hard to make comments since I can see everybody. I'm just listening to y'all, and it sounds way overwhelming to me right now. Thank you.
Thank you, Commissioner Herron.
It's just too much. I don't have all the reports that
Right.
I needed. I just wanted to let you know that I don't have the reports from the consultant.
Right.
So I just, I'm gonna wait until that.
I'll circle back with you on that. I actually have that now, and I'll forward that to you afterwards. Thank you,
All right.
Commissioner Herron.
All right, Commissioner Hovley, that is all I have for the dashboard and my report, unless there's any other questions.
Okay, let's go to our next on the agenda, and that would be Mr. Ritter.
Do we have CFO Ritter with us? If not, I have a backup plan.
No, yes, sorry, Renee. He is otherwise engaged with a tow truck, as it
Still
turns out.
still
so
detained.
he will
Okay.
not make it. Yes.
Commissioner Spikers, if it's okay with you and Commissioner Howgley to delay the Finance Committee report till the end until CFO Ritter can join us, that would be fantastic. I know that Director Poss is here and she could jump ahead and do her presentation if that's acceptable to the board.
That's fine with me.
Okay. All right. I'd like to welcome Director Nicole Poss. She is your marketing director. And, oh, Jen, is she? Not seeing her either.
She is running to her office to start her presentation.
Okay,
Director
great.
Ducato just.
Uh-huh.
So this
Fantastic.
Is
Well, maybe-
flexibility.
Maybe I'll give her a second. I'll buy her some time as we bring up her slides. So tonight, Nicole is going to share with us. I know that you've all been very interested in what the marketing team has been up to. In our budget this year, we did approve to add an additional person to this team. And so she is going to share with you exactly what we're doing and how these things are becoming effective. And we are actually able to, through some of the statistics that she's going to present, we can show the areas where we've been engaging with our community that is actually driving volume in some of our operational areas. So we are excited. I hope that you guys will ask her lots of hard questions. She is prepared for those, and I'm really excited to show her work. She's also in the process of updating that annual report. You all hopefully received a copy of our 2023 annual report, and so we will get your 2024 out here shortly. The team has been doing a lot of work on that, and I think you'll be very happy and very pleased with it. Does anybody have any questions about what we're doing in marketing while we're waiting for Director Poss to get up and going here? It is a night of technology challenges.
Oh, Renee, Commissioner Herron has a question. Go ahead.
Okay,
Commissioner.
great.
Yeah,
Go ahead,
one
Emma.
of the question is how are we marketing our medical aesthetic clinic? It seems like several people I talked to on the Ridge have never heard of any of our aesthetic medical, and there are a couple of aesthetic medical that's on the Ridge that's doing a real heavy marketing on this particular service. So how are we doing our aesthetic medical marketing to reach out to these people in the Ridge that are interested in?
Thank
Getting
you, Emma. That is actually
access.
a really, really good question. Medical aesthetics is one of those areas that is extremely advertising heavy, and it requires a ton of focused recruitment and advertising to build that program. So right now, I would say we're doing basically kind of like a slow launch on the advertising. We're not heavily advertising target marketing with social media or other expensive ways of marketing. Most of the marketing that we're doing is internal and through referrals. Dr. Moore has gone out and done some in-person visits to some targeted groups within like the wellness areas or some of the gyms, and has recruited some of her patients that way. We are not prioritizing the marketing in the medical aesthetics area, however. We do not have a dedicated provider to this, and it's not a full-time service for us. And so we are really waiting until we have somebody maybe in plastics or somebody dedicated to this before we do full-blown marketing. It's one of those secret kind of like slow roll projects that we're working on, and I think that we're focusing our marketing team in other areas for our physicians that need to have their practices built. And Dr. Moore, would you like to add to that? I see you're off mute there.
Yeah, absolutely. I thought I would kick in too. I just wanted to be really clear. It is not through lack of Nicole and Anna and their expertise. They are extremely good at what they do. And with aesthetics, medical aesthetics in particular, Commissioner Herron, I think you'll recall we did hire a dedicated provider about, it was almost February last year, who stayed with us for just a few months, and that was most unfortunate. But the other part of her job was as a psychiatric A&P, and she wanted to focus on a practice that was closer to her home. And so, despite that effort to try and get a full-time provider or even a closer to half-time provider, that did not pan out for us. So right now, in order to fit the providers that we have coming on this year, we are in fact going to give them the aesthetics room. So we would be in a position to even have to more, I don't know, strategically place these patients in between visits, and I will continue to see them. But marketing efforts continue, and Nicole and Anna do a fantastic job with that.
Yes, but
Do we even have any numbers for it when we first started this project? And if so, was a research done to see whether that there is that great need of service in our valley?
so
Yes.
Emma, we see this as a complement to our current services, not a major service line. And so it's there's really no cost to this except for the consumables. And so it's kind of a complement rather than an entire like focus of what we're doing. So we don't necessarily track it separate from our other outpatient visits. And we don't, I guess there's not, it doesn't have its own like line item budget and department.
Oh, okay, thank you. I won't
You're
take too much of your
welcome.
time. Thank you.
No, I
I'll-
appreciate the
next
questions. Thank you. All right, Director Poss, I'm sorry to jump ahead on the agenda but thank you for being willing to be flexible. And I think I've teed it up and we're excited to hear what you have to say.
No problem at all. Thank you so much, everyone, for having me tonight.
Thanks,
As Renee
Nicole.
said, for those who may not know me, I'm Nicole Pass, our Director of PR and Marketing. And today I wanted to walk through how our marketing strategy is designed to build trust, drive growth, and strengthen our connection with the community. We'll look at how we approach patient acquisition, highlight key community engagement and special initiatives, and share some efforts about how our metrics are performing. And then I also wanted to preview our 2025 community events with you as we continue to strengthen our presence and relationships in the Valley. Next slide, please. I first wanted to share a really important statistic with you, and that is that 81% of patients consider hospital reputation before choosing where to seek care. In marketing, every message, every channel that we participate in advertising on, and every campaign is backed by strategy. And I have a list of the most utilized marketing channels there. So where are patients going to look when they're looking for information about a hospital? And a lot of it is going to Google and going to look at online reviews. And so we do put an emphasis there. People also visit our hospital website. They want to see if we look legitimate. And so last year when we rolled out a new website, that was a really big deal for us and something that we're really proud of. We want to make sure that healthcare is really accessible to our patients. So are they able to click a button to make an appointment? Are they able to easily find phone numbers? We sort of have this running joke in marketing that, booking a healthcare appointment should be easier than booking an airline ticket. And so we really want to increase ease of access for our patients. Nothing is random and everything is designed to support growth, trust, and connection. And we really see marketing as a strategic and critical business function of the healthcare industry. Next slide. So one thing that we do is a lot of digital marketing, and we really ramped this up last November. And we've seen, I'll go over some stats later, but we've seen an increase in patient volume since we started doing that. So one thing that we're doing a lot of is website and search engine marketing. And so when we have someone in our local area that goes to Google and they search hospital near me, we're actually paying now to come up in some of those results, whereas before we were just relying on Google's ability to put the most relevant information in front of patients. But now we're paying to be in those top places. And so we're being more competitive and sort of competing with our local competitors for that top space that patients will click on. And I have some performance metrics for you that, on that later as well. This digital marketing.
Does anybody have any questions? Oh, sorry, Nicole, can I jump in?
Yeah.
Does anybody have any questions about digital marketing and what it is and how it's working? Let's give you a chance to ask Nicole some questions.
Yeah, what means of digital are we using?
Oh, so we are trying to be everywhere. So through social media, digital advertising, email campaigns, we're promoting our services, events, and also timely health information and education. So we really want to be everywhere that our patients could possibly be looking for information about healthcare and be the first provider there to meet their needs.
Thank you.
Yeah, definitely. And if there's something that wasn't on my first slide list where you go to seek information about a business, I'd love to know where that is so that we can potentially reach another demographic. So other things that we do is also manage our online reputation across platforms like Google, and we're even on Yelp, which a lot of people think is mostly for food, but healthcare is also there because we see what patients see online often shapes where they choose to go. So here are just some examples on the slide of our recent digital advertising. So the ones with the Meet Jordan Wallace and Get Back on Your Feet, those are all highlighting some of our specialty services on Google. So we're doing the search ads, which I let you know will show up. We're competing for those top spots to show up, but then we also have these display ads where the picture shows up not just on Google, so it's also showing up on other websites that you might visit or frequent. And so if you ever see any of these, let us know, because they should be populating in your kind of area also.
So are you implying if there's a lot of pop-ups on our means of reaching out in every different digital?
Sure. Not so much pop-ups, but if you are on a website that you visit or on like the Snoqualmie Valley Record website page, you will see some digital ads there on the sides or on other websites that you might visit. And if Google thinks you might be interested in our content, then it will show our ads to you. So it's been really effective. I can't wait to show you the results. And we're gonna keep doing
that.
That
would be interesting.
Yeah.
Okay, that would be interesting. And is it user friendly, right?
Yeah, absolutely. So when people click on any of these pictures for the ads, it takes them to our website or to our schedule an appointment page on our website, which even lets new patients book right into Epic. So they can click on the links and get straight to the appointments, pick a provider, pick a date that works for them. And it's really nice that not just reoccurring patients or patients we already have can book online, but new patients can also book online, and it's just very convenient. They can pick a date and time and provider that works for them.
So is it just geared for patients, hospitals? So how do we, how is confidentiality preserved?
So that's a really great point, Emma. Thank you for asking. So healthcare has a lot of extra regulatory requirements that we must meet in advertising. So we're not allowed to collect any HIPAA information. And through our digital advertising, Google has the ability to let us know IP addresses, names, zip codes, things like that. But those are all protected, and we don't participate in any of those metrics from a healthcare organization. We're not allowed to. So we protect people's confidentiality. So you don't have to worry about visiting our GI webpage and then having a colonoscopy ad appear somewhere that could be humiliating for you.
Okay. Okay, thank you.
Good
Yeah.
questions, Commissioner Herron. Thank you.
Absolutely. Thank you, Jen. All right, so community engagement. That is a key part of building brand awareness and trust, and something that we have putting a ton of effort into over the last couple of years. So through different events and sponsorships, we show up where our community is. So where are they gathering? Where are they celebrating? Inviting them to join in and celebrate with us. Public relations helps us share important news and stories through local media. And then we also highlight our providers with testimonials and spotlights, and use tools like the annual report to share impact and reinforce transparency. After all, we are a public hospital district, right? We are accountable to our community, and we like to share information with them. So there's just a couple of examples of how we're doing that over to the right. So a recent news article for our Snoqualmie Valley Health assault treatment program. video we made about meeting Dr. Wallace. So we did a bio video on him that parents could watch and get more comfortable before they choose a pediatrician. There's some information about our brunch we've been helping plan. And then down below, we have a picture of one of our community events and a provider testimonial that we shared on Instagram. Next slide, please. All right, so marketing also supports strategic growth through initiatives like the North Bend Clinic launch and mammography service promotion, from grant writing all the way through cutting a ribbon and then bringing patients in the door. So lots of involvement there. We also run data-driven campaigns to track patient volume, loyalty, and brand awareness across all of our channels. And one fun thing that I wanted to share with you is that we're doing a monthly new movers program. And so anyone within approximately an 11-mile radius of our hospital who moves into the area will get a postcard welcoming to the community, or down below to the right, you can see welcome to the neighborhood. And we just sort of introduce ourselves and invite them to make an appointment with us as their new healthcare provider close to home. And so we kind of expand that radius to get to about 1,000 people a month. That's our goal. So 1,000 households each month are getting postcards from us.
Wow. And geographically, how broad is that, did you say?
About 11 miles is where we're going out from our hospital to get to that 1,000. But if it's not pulling up that many new movers that month, then we'll bump it up a little bit. Or sometimes we'll actually just include some people who got the postcard last month so that maybe on the second push, they'll decide to book that appointment.
Great. Great.
Yeah.
And interesting demographics just beyond the geographic, if you will, excuse me.
Nope, it's really could be any kind of personal demographics, age, anything, just if
Okay.
you moved
Really
within
broad.
that radius. Yeah.
Got
So
it.
casting
Okay.
a really wide net with that one.
Thank
And
you.
just yeah, even if they're not booking an appointment, then they're just aware of who we are. We're just saying
Yep.
hello and introducing ourselves.
Thank you.
Yeah. And then we also have been doing a lot of work to support employee engagement through internal newsletters, recruitment efforts, and integrating our values into all that we do. So that's also some ongoing work. I have here a photo of some rocks. We're introducing a Leadership Rocks program where we will be giving each leader 4 rocks a quarter. They'll hand these rocks out to recognize people who are not in their own department when they are living out one of our values. And if they can get 4 rocks, then they will get a special swag item that says "Be Bold." And so it's sort of exclusive, but we think it'll be really fun. And then that special white rock that just has the colored rocks from our logo is for Renee. So she gets only 1 a month. So 12 a year. And if you get that, you skip to the front of the line because you're just exuding all of our values.
This is a really fun program. It's a continuation of our employee recognition program and will feed into our annual recognition and awards night.
Right. Thank you, Renee.
Any questions for Nicole on anything on this slide before we move into the data? Because I know you guys are all excited about the data. Okay.
Go for
Thanks,
it.
Nicole.
All right. So I wanted to provide you with just a snapshot of our impact so far this year. So all of this data that I have pulled up is year to date, starting in January. And some fun things I just wanted to highlight was that the website saw over 32,000 unique visitors, while Google Ads drove more than 12,000 clicks from 715,000 impressions. So that means that 715,000 people saw our Google Ads, and 12,000 of those clicked on one, and that contributed to our 32,000 unique visitors. That means Kevin Hougley visited, and it only counts you 1 time. If you visited 3 times, it still only counts you as 1 unique visitor. And overall this year, since January, we've had 65,000 plus website viewers. So how important is that new website we rolled out last year? We want it to be convenient, easy to navigate. It has to be, or they'll choose to go somewhere else. So that's just the importance of that tool. We direct everything back to our website and back to that make an appointment page. So we're really trying to drive new volumes and new patients. Questions on that?
It's exciting.
It is really exciting. It's so fun to see the numbers, and I'm happy to share them with you all. We also have Google My Business. And so if you ever search for a business on Google and the profile that comes up, that's what I'm talking about. So if you search for Snoqualmie Valley Ridge Medical Clinic and you find a profile, so Anna and I measure and manage all of those for the hospital district. And so that's what's feeding into these statistics. So far since January, over 1,200 people have clicked to get directions to one of our locations from those Google profiles on our businesses. It has generated 3,800 calls to our hospital district, and that has generated an additional 4,700 website clicks. So those seemingly benign profiles on Google, they actually really generate a lot of action for us.
So question on the surveys, when our patients have been served and they get a follow-up survey, is there anything in that survey that might speak to the confirming that they learned of us through your efforts?
We don't have that in the survey right now. That's a really good question of something that we could consider adding. Yeah.
Trying to track where they're coming from, you know?
Yeah, I'd love to see that data. So tying it back to the business metrics though, you know, we've seen a great increase in volumes, and where we're doing our digital ads, we were actually advertising as far east as East Seattle. And Will was seeing an increase in clinic volumes from that area, but we just hired a really great person in informatics so that we can hopefully get some additional reporting out of Epic to be able to tie those metrics back to our advertising and where we're spending our dollars to make that even more efficient. So yeah, we're trying to dig in really deep to the data, but we have to let this person settle in first before we can get some more info.
Great.
Yeah. And then I have some.
Nicole, would you be willing to share your story about, so you had been doing some advertising and then we had to take it down because there's a lot of rules and regulations about what you can and can't advertise. And somebody was like, what happened to our volumes? And lo and behold, it was because some of Nicole's ads were taken down. Can you tell that story for us?
Sure, absolutely. So in February, we had started these ads back in November, but in February, my team, the advertising team, we violated a community standard on Google advertising. And we were working through trying to get those ads got turned off for our emergency department specifically. And we were trying to get those ads turned back on. And then one day Patrick reached out and said, hey, like, is there anything that you're doing differently because our emergency department volumes are down? And I said, well, actually, yes. Our ads were turned off and we're working on getting them back up. And so we really did see a decrease in utilization there once our ads were down. And we think that because the emergency department near me and those kinds of ads were taken down, we were seeing a decrease in volumes. So we have seen some actual impact, even though we can't quite get the data out of Epic just yet.
Yeah, I love that story because it does show that the work that you're doing is impacting the business and it is making a difference. So thank you.
Yeah, absolutely. Thanks for asking.
So what was the Google violation?
You know, we actually aren't too sure. It could have been just one keyword that we used in our ad. We also changed the photo. It was a photo of an ambulance. And so I don't know if they thought that ambulance photo was too jarring for a viewer or quite what it was, but we were able to get them back up. Sometimes they give us really general answers and we just have to fiddle until we can get them working again.
And it was specific to the ED.
Yep, it was specific to ED. Yep, all the other ones. We have our Google advertising broken into various campaigns, which is actually what you see over here, where it says Google Ads year to date, and it has the circle. So you can see emergency care near me is just one of the many campaigns that we have going. And so, yeah, so that was the only one that was troublesome, but we got it fixed. And then back over to the left where it says year-to-date social media growth, we compared this to the previous period, and we were able to see a 229% increase in impressions, 107% jump in link clicks, and a 40% net audience growth, which is very good. Right. And if you're wondering why the clicks on the right don't match up to the clicks on the left, these are just the top keywords that were coming up most popularly. So emergency care was very popular.
Okay.
All right. Next slide, please. All right, so Community Events 2025. I first wanted to share a little bit of information about 2024. So in 2024, we connected with over 4,000 community members through our events, supported by 134 hours of volunteer time, not including the behind the scenes work. And so we were able to touch a lot of lives in our community. Like I said, we wanted to be everywhere that they were, everywhere they were gathering, everywhere they were celebrating. And this is just one example of how we're getting out to them. But we're continuing that momentum this year with a strong lineup of events across the Valley. And we would love for you to join us at any of these that you are able. So I can go ahead and email you out a calendar if you'd like to join. We have some t-shirts. So you could just show up and grab a shirt and hang out for a little bit, stop by and say hi. And yeah, we're really looking forward to the rest of them.
Do you guys have any other questions for Nicole? We, again, would encourage you to help support our booth and come out and join us for any of these events. It's always really rewarding to get to speak to the community and talk about all of our services.
Thank you, Nicole.
All right, Nicole, thank you so much for presenting tonight. I really appreciate it. And thank you for being flexible on the time.
No problem. Thank you all.
Yep. Thank you. Renee, do you want to go ahead and jump into the finance committee?
Let's do it. I am actually,
report?
thank
And
you.
Dave and I can jump in as well.
Yeah, thanks to Shauna. I can attempt to do this for you, but I'm going to give her all the credit.
Oh
she's on
yeah,
camera.
I'm sorry,
Yeah,
Shauna.
I told her if I screw this up, she's going to have to do it. So she gave me something to help with this. So, all right. So we'll jump into the finance packet. And of course, Commissioner Spikers and Howley, feel free to add anything you would like. So some of our key metrics that we are highlighting in the finance report tonight, year-to-date operating net income is at 800 and I will do 850,000 plus. We'll do CEO math, looking good. So we've got a really good bottom line. $785,000.
There was a pause. We're good. There was a pause in the signal.
Oh, sorry.
You bet. Go ahead, Renee. Thank you.
Okay. Doing good with our change in that position, 785,000. Year-to-date EBITDA, almost $1 million. So that's, I love to watch the EBITDA metric. It's one of my favorites. And
Jennifer,
we're
can
looking.
excuse me, Renee. Jennifer, can you go ahead and show those slides, please? Thank you very much. Thank you,
All right.
Renee.
Sure. So year-to-date days of cash, 252. Considering where we have been and where we started, that's a really good, strong cash position. And as we've mentioned, with the hub project coming, we are definitely wanting to conserve cash and build our days on cash as much as possible because we will be spending it. Year-to-date in the AR is at 53 days, and year-to-date total cash, 40 million. So we're doing well on the financial side. In the income statement, we'll move down to the income statement there, Jen. Shauna has split our tax revenues between operating and non-operating, so I think that's helpful to see where those tax revenues are being allocated. And we have now taken our PTO accruals and reclassified those from benefits and salaries, and so we can track our liability or what could potentially be a liability with our days of PTO. And fully amortized assets have been removed from the book. So instead of leaving amortized assets, we have removed those. So you won't see those as well. We will go through volumes in the dashboard, so I won't go through those. Uncompensated care and write-offs, 180K in financial assistance and write-offs, over $1 million in bad debt year to date. So those are some metrics that I think is really important for us to tell our story with our community is the amount of financial assistance and financial support we actually do provide to our community through uncompensated care. AR allowance has increased to 36%. Basically, after the audit, they wanted us to make sure that we were increasing our allowance for AR just because they feel like we potentially could not collect some of those things. And so they want to make sure we have a conservative estimate there. Things that are driving expenses and budget. Let's see, pro fees are over budget. This is basically mostly the 520K of over budget is due to the hub audit. We get to pay for audits as much as we love them. We pay for the pleasure of having them, and that was included in some of that. Informatics, and then some costs in our foundation. Contract labor is over by 183,000. This is mostly in therapy and endoscopy. Good and happy to report that our medical unit and ED usually in nursing is a big driver for that contract labor, but they're actually doing very well. And we are just struggling to getting some permanent staffing in both therapy and endoscopy. However, in endoscopy, that contract labor has been very beneficial. We've been able to open up additional days and have extended hours, and we've been able to see more patients. So it has definitely been very helpful. Supplies are over by 100,000 due to patient-facing departments and the cafe. So because when our volumes go up, our supplies go up, that is to be expected. And so if we are seeing greater volumes than budgeted, then we might also see greater supply expenses. We also, when we transitioned from Morrison to having our own employed staff in the kitchen, there was a error in allocation of where those expenses went in the budget. So it's making it appear that supplies and dietary are over budget. However, the total cost is budget neutral. So we're not concerned about that at all. Repairs and maintenance were under budget by 129,000. I suspect that won't sustain itself throughout the year. Usually we do a kind of an allocation per one every 12 months. And so those repairs and maintenance kind of come in big hits at one time. So we may not have something this month, but maybe later in the year we'll have something more. And so I predict that will probably normalize once we get through the year. We incurred $205,000 in interest expense for the 2024 LTGO bond, and this is a very positive thing as it is helping support the pre-construction for the hub. So we expected that. So I mentioned the audit. So the Moss Adams audit, 2024 financial audit was finalized with a clean opinion. So that is fantastic. Moss Adams joined our finance committee and gave a more thorough report there. The accountability audit for 21 through 23 is under review. We expect that to be finished in April. And we are working on, Shauna says, sales tax refund prior to B&O filings. I believe that Patrick mentioned that the finance team had about 3 to 4 audits all happening simultaneously at one time, plus trying to get all of our regular business done. They've been doing an outstanding job, and we really appreciate their efforts there. Before we move on to the dashboards, Commissioner Haugley or Spakers, was there anything else on the income statement, balance sheet that you would like to mention or
go ahead, Dave? I've got a couple of comments, but you go ahead, Dave.
Well, I had given Patrick about a 3-page set of questions because
read my mind.
If I would have asked those questions during the finance meeting, it would have taken an extra hour, I guess. And I didn't want to tie up the whole team. And he was very, very quick to get back to me on answering. And what you just
hold on.
Reiterated.
There we go. Got it back.
What you just reiterated, Renee, is a lot of those answers that he had given me on the questions, which I CC'd you so that you knew that what I wanted to hear. So I just want to tell you, everybody, the complexity of the finances is getting more and more complex. Our meetings are longer. They're more involved. You almost have to be an accountant to be able to read some of the many bits of information. And I know it's taken me probably 50% longer to review the information prior to the meeting. So I will continue to try and sort things out. If there's something out there that I need to know, I now know. Well, I always knew that I could depend on Patrick to give me the answers for, but I'll let you know if there's something. Sorry.
Thanks, David. We really appreciate those questions, and it is helpful, and they are fantastic questions, so we do not mind taking the time to respond to those. So we appreciate them. Thank you.
But I do have a question on the income statement.
Go ahead, Commissioner
On the
Herron.
total other revenue, it looks like for March 31st, 2025, year to date, the actual is 17,787, but the budget was 266,168. Can you explain that? I don't quite understand
Under
why.
the other revenue there.
That's a big, yeah.
Okay.
The other revenue.
Shauna?
We didn't make our, I mean, we dropped
Excuse me.
on our budget.
Shauna, can you speak to that?
I sure can, and Jensen, please feel free to
Thank
jump in. The primary reason associated with that is the SNAP payments that Jensen
Go
was
ahead.
referring to earlier today. And the fact that we budgeted for those SNAP payments for the first quarter, but we have not received any of those. We do expect those to start coming in, as she mentioned earlier tonight, and we will record those as we get those numbers from the state.
Okay.
I do want to mention that we are recording expenses throughout the year on those already,
Mm-hmm.
and
Mhm.
on paper only. And so, you know, a county is a funny creature because numbers seem to flow from one column to the next depending on what happens. And I've never been able to quite understand it myself, but the balance sheet shows one thing, the reality shows a different thing.
Yeah.
So just want to let you know that it can be a little bit deceptive. It's not illegal or anything like that.
It's,
It's just a little deceptive the way you read things.
yeah.
And then you're doing the right thing by asking the questions and seeking out the explanations.
Yeah, another question I have is on the cash flow for the current year. I'm not sure if I heard it correctly, but according to this report here on the paper that I have, it's a very tiny miniature font. It says cash current year. Is it correct? Am I correct in saying 40,567,926? Is that our current cash?
That is
on hand
correct.
or Cash flow? Is that right?
Cash.
That is,
on
yes,
hand.
that is year to date, Emma.
Up to date. Okay, thank you.
You're
And I
welcome.
do want to comment, one last comment, because people don't understand, back 6 years ago, we had maybe 14 million in cash, and then 10 years ago, we had zero cash. So we've got 40 right now, 17 of it, or roughly 17,
Mhm.
due to the LTGO bond. So
Yeah.
even take that away, and we have 23 million in cash, which is 23 million more than we had 10 years ago in cash.
Right. Yeah. So I was going to, thank you, David. So what I was going to do is, you read my mind when you talked about the 3-page questions. Obviously, I was CC'd on that, and then the response from Patrick was CC'd back as well. And thank you very much for asking for clarification on all of those points. It was really well said.
Yeah.
And yes, you betcha. You bet. And so the questions were really good that David had asked, and the responses were equally as good, clarifying the response back. So kudos to both David and Patrick for that. I appreciate the attention to detail. I wanted to bring out, Shauna, you might be able to speak to this, and I think it's an important piece because it's a big piece, and it speaks to with regards to our North Bend Clinic. And in your highlights here, we talked about the North Bend Clinic lease booked at $661,000. Can you explain when we use that terminology, when it's booked $661,000, what does that mean to the layperson?
Absolutely. So that in essence is the amount that we are required to book in our right to use assets, because this is a long-term lease. There is accounting regulations associated with that. So we have to book an asset and a corresponding liability, and you will see both of those as right to use assets on the balance sheet. And as we make payments associated with those terms, which we will start making in September of this year, we will offset those to reduce the amount.
Yep, very good. So it counts against the balance sheet, reserved, if you will.
It does. It's kind of like a fixed asset. We purchase the asset, and so when you buy that asset, you book it on your balance sheet as an asset, and then you depreciate it each month, right? As that
Yep.
as you go through the estimated useful life of that asset. The same works very similarly, if you will, with a right to use asset. And so because of the new regulations associated with right to use assets, you are required to determine what that associated asset value would be, as well as the corresponding liability. And then you will amortize that and record the interest expenses you make each monthly payment.
Very good. Thank you.
Mhm.
Okay, Renee, anything else with regards to your end of it?
Let's scroll down to our dashboards. I really think the dashboards are a great way to have a visual of what's going on with the financials. It makes it a little easier to understand sometimes without all the numbers. But you can see the days cash there. Oops, sorry, Jen. Back up to our financial metrics. There we go.
There you go.
Definitely doing better than last year and better than budget. So we're happy with that. Our days of AR are climbing slightly from earlier, but still well on track and below where we had hoped them to be. Are doing good with our FTEs, number of employees, and let's see, thanks, Jen. Our patient service revenue is right on track with budget. We had a stellar January. February was down a little, but we recovered in March and doing well there. Salaries and wages are right on track of where we expect them to be. And then the net operating income overall year to date is good. However, March, we were hoping it would be a little bit better according to the budget there. So nothing concerning there. The financials are looking strong. And Jen, next page, please. Thank you. All right, Dr. Moore, you want to go through some of the volumes?
I do. Thank you. And thank you, commissioners, for your patience tonight with all of our various tech issues. All right. As always, I have tried to select the most meaningful information for you from the graphs, but the graphs are in front of you, and please pause me at any time for any questions. So I will highlight, however, our volumes that Shauna was kind enough to also put in your highlights. So of our volumes, and let's see, I've got to look at a couple screens here. So ED department visits, as you see, ED visits were up this last month. Year to date, our ED visits are 1,724, which puts us at an average of 19 a day. In 2024, which was a big year for us in ED volume, we were at 16 a day at this same time. So continue to see healthy growth there and very excited about that. When I spoke with Abby Wallen about this report and how she was feeling, she also stated that the SAFE program, which was launched, which we spoke about, was a big part of a win for the ED this month. But secondly, the launch of the Code Committee. Code Committee is a multidisciplinary group looking at codes throughout the organization, such as Code Blue, Code Gray, Code Stroke, and so forth. So that team has done some really great work and launched the Code Committee with Tricia Ralston, our CNE. So good stuff coming out of our ED.
What's wrong with February?
I'm sorry, Commissioner Herron, I
What-
didn't hear
what
that.
was
Can
that?
you repeat it?
What's wrong with February's graph? It drops and then goes back up. Is there something unusual happening in February that
I think
the volume does?
Commissioner Herron, February is a short month, and so sometimes we see less volumes in February because of the fewer number of days. I can't guarantee that's 100%, but it definitely will be a contributor.
Okay, it looks like, okay. Thank you.
That was a great memory on the spot, Renee. That's exactly what I would have said as well.
Yep,
Most
I
of
was
the time
thinking
at
the
that
same.
28 days, it makes a difference. So yeah, very good. Thank you for that. So let's hop over into ambulatory. You see from the graphs there, ambulatory volume appeared in RHC and non-RHC to stay fairly flat. However, revenue is over budget, and so clinics are doing great there. We did notably have one physician out, and it's one of our higher volume physicians, Dr. Jane, was out for 2 weeks last month. And so that did impact volumes and does tend to when we have providers out. But they are catching up. Let's see, we've got urgent care again up slightly. Otherwise, nothing of note there. Actually, that's not true. I do have something to tell you about in urgent care. There is a win. They did report during the quality committee, Will Pan did, and I thought this was great to share. With all of the volume that urgent care had in the last month, they had 100% patient satisfaction score. So every single patient that was seen that filled out their survey stated this was a place that they would go back to, and the score was 100%. So very excited, very proud of our urgent care providers. You can imagine again in that setting, people are sick, not feeling well, and our providers, per our patient story, which you also heard tonight, are doing a fantastic job providing care.
Dr. Moore, I have got a question. I'm going to cut in, if I may, about the
Please do.
when providers are on much needed vacations or wherever they are. Do we have a backup provider to be able to fill in some of the gaps?
Yes.
So we offer that to
We do. We do.
Would you, David, I had a brief cutout. David, would you please restate the question?
Yeah, I can hear that.
Yeah, I don't know why my microphone is, I think it's doing.
No, you're good.
okay.
I think it's a signal on my end as well, Dave.
Okay.
Anyway, please.
So when providers are on their much needed vacations, do we have backup or do we have another provider that is offered to patients when they come in so that we don't end up with the really, down month,
Got it.
so
Got
to
it.
speak?
It's a
Thank you.
great question.
Because that's
Great question.
been kind of the norm for many, many years. So
Yeah,
We got a
thank
lot
you,
of
Commissioner
backup
Spigers.
people filling in.
It's a great question. I will speak to Dr. Jane in particular, but you do see this across the board. So to answer the first part of your question, do we have a backup plan? Certainly, we do. We have excellent access to care, meaning you can get into your provider most of the time within the week, if not the day that you desire to. We also have a very loyal population. And so, with Dr. Jane in particular, while we have a number of family practice, NPs, also other providers who could see her children, so to speak, they will often wait until she is returned. And so, while the urgent care will see those children in the urgent care for acute illnesses, colds and coughs and so forth, well child checks, scheduled visits, which are preventive health, they will wait often, the patient will, by their choice, until her return. But we do always monitor the number of providers that are out in one clinic at one time and ensure that we have excellent access for patients to continue to be seen.
Dr. Moore, I'll jump in on that too. A lot of times our providers, if they're going to have an extended leave a week or, more than a day here or there, we know quite a bit of ways in advance. And so we're able to block their schedules and clear it ahead of time. And so patients that are seeking routine care, routine visits, things that they're following up on, that they won't book that week. And so we do see a decrease in volume. But as Dr. Moore mentioned, if somebody has an acute need, we can definitely get them in with other providers or into our urgent care. So we're not losing those acute visits, but we do definitely see a decrease in those scheduled visits. People love their providers and they want to wait for them.
yeah, that makes sense for Dr. Jane, that's for sure.
Yeah.
Yep.
Commissioner
I
Herron,
just
did you
see
have a
an
question?
endoscopy visits
Go ahead, Emma.
that it has dropped considerably. It's not even moving an inch there. So it seems like we are having problems on that particular department. And let me tell you why. It seems like I made a phone call to see whether, my husband can be seen, but
Mhm.
I feel sometimes that the elderly, when they reach a certain age of above 70 or 80, they don't seem to be interested in looking or consulting with this patient. So I don't know if that's the reason behind it. It was not a pleasant call. It seems like I was given a runaround. They don't even, I just call, I was calling on behalf of my husband. So
Mhm.
I was very, very disappointed. So I said, never mind. My husband says, so just cancel. So
Commissioner
we're not
Herron,
seeing,
we're really sorry
we're
for
not
that.
going there anymore. Remember earlier I said my husband was thinking about, using our hospital, utilizing that because it's closer to home. But it was a big disappointment. So now I can say why we are dropping.
Go ahead.
Commissioner Herron, thank you for that
It's aging,
feedback.
not
We're
just
sorry.
a young population. So
Right. Commissioner
Herron.
Herron, she's trying to respond.
Yeah,
Yeah, go
thank
ahead.
you
I'm
for
sorry.
that
I-
feedback. I'm sorry that was your experience. I definitely will have Dr. Moore reach out to you and learn more about what the challenge was, because we wouldn't want anybody else to have that same experience. On the graph, what you see here is actually 2 months that were one that was above budget and one that's right on budget. So there really is only one data point that is below. And I'm sure Dr. Moore is going to address that in her volume. So Tammy, I'll
Okay.
change it back to you.
Yes,
All
thank
right,
you, Renee.
thank you.
And thank you, Commissioner.
You're welcome.
Thank you, Commissioner Herron. I will reach out directly to you so I can understand better what your experience was. But again, I'll reiterate that that is not what we want. With endoscopy, we have excellent leadership in endoscopy with Stephanie Gilman and of course with Will Pand, as you know. And we had quite a bit of effort to call patients back last month. For whatever reason that we cannot discern, we did not get any call back. So you call a patient, you leave a message, and the callback rate was very low. Unlike other months, which you'll recall in fall and late winter, we had issues with the Medivator. That's been replaced. That's been put back, is
Scope,
up and running.
yeah.
We can clean twice the scopes. We've done very well. So the team has every effort to get them scheduled, and it just was a down month. Now, having said that, we have 49 exams scheduled in the month of April for endoscopy, and we have conducted many of those. So
That was
while
my
we're
next
nearing the
question.
end of the month,
Wow.
I don't know where we're at. I'm hoping, Commissioner Herron and the remaining commissioners, that we come back with a very good month for you for performance.
I
But
don't
we'll
know.
definitely.
It's up to my husband to see whether he.
Yeah,
Understood.
Commissioner
I
Herron, we will
Thank you very
definitely
much.
follow
He's
up
a
with
very
you.
picky doctor, picky patient.
Thank
And
you.
they thought he would support our hospital, but
Yep.
it was a disappointment. Thank you.
Yep. Thank
Yeah,
you.
I
we'll definitely
understand,
follow up.
yes.
So commissioners, you guys received these dashboards ahead of time. Do you have any additional questions for us or things you want to know more about? All right.
Anybody else?
If not,
Well, I think, what I'd like to make a comment is because daily census have dropped in patients. However, our swing beds have gone up. So sometimes it plays a role reversal. Sometimes the swing bed is down or whatever. Yeah,
Yep.
I just wanted to make a comment. Thank you.
Things tend to move around.
Yeah.
all right, Commissioner
Anybody else?
Havley. In the interest of time, we will turn it back unless there's any additional questions, and we'll send it back to you guys for the approval of the warrants.
Yep. Let me go ahead and pull up that slide. Okay, let me get my magnifying glass out. Okay, everybody, I'll go ahead and, there you go. Thank you very much, Jennifer, and you're very kind. And I'll go ahead and call for approval of the warrants for the month of March 2025 in the dollar amount of $5,187,295. Do I have a motion to approve that?
I'll make that motion.
I did have made a note on that, and now I can't find my. here we
Okay.
go.
Commissioner Herron,
That's okay.
hold on just a
I
moment.
think what you probably were gonna ask, why is it so high? Well, a lot of those warrants have to do with the MOB, the cost associated with that right now.
MOB in the hub as well.
Okay, so Mr. Chairman, you have a motion,
motion.
but not a second, and you're already
You're-
beginning discussion.
you're
So I
reading my
suggest
mind.
that you wait for a second and then in discussion.
Understood. Thank you very much, Commissioner Skip. Thank you very much. So with that, I have a motion on the floor. Do I have a second to approve the warrants?
I'll second.
Thank you, Commissioner Carter. With that, is there any future additional discussion on the motion that's been made and seconded? Okay, hearing none, I'll go ahead and call for the vote. Approval of the warrants for the month of March, $5,187,295 for the month of March 2025. All those in favor, please say aye.
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 Opposed? And abstaining. Did I hear Commissioner Norris?
Yes, I'm here.
Okay. Was she a aye?
Commissioner Norris, can you confirm your vote for us, please?
Yes, I can do that.
Thank you. Are you voting in support of the motion?
Yes.
Okay,
I
great.
am.
Thank you for the clarification.
Thank you kindly.
Uh-huh.
Okay. Motion carries. Thank you very much. Okay, with that, I'm gonna go ahead and warrants, and now we are on to, give me just a second here. I'm holding my cell phone and trying to facilitate this.
No
Give me
worries,
just a-
Commissioner Howgley. I can help you out if you want. We're going to go on to item number 7B and talk about the board retreat at Suncadia. And
Thank you.
basically, we are excited to have a little bit of support from AWPHD to have a great strategic planning retreat. We'll be bringing in some guest speakers. I believe Matt Ellsworth will be joining us either in person or remotely. We are just looking for a date that works for everybody. And last month, we've had great success asking you at the board meeting to check your calendars. So Jen has the options for the strategic planning retreat up here in front of you. We're looking for, I love Jen has this as a 24-hour experience. So in addition to strategic planning, board development, we also have heard from you that you would like to have some more opportunities for team building and trust building between the board and executives. So we will have some focused time for that as well. So Commissioner Howgley, I don't know how best to move through, but we're just looking for confirmation from the commissioners if any of these days would possibly work for you.
I'm going to go ahead and
Any of these days work for me, except I checked that there are 3 days that will work for me.
Okay, Commissioner
The
here.
Monday, Tuesday, May 5th and 6th, May 12th and 13th, and June 9th. Monday,
Okay.
Tuesday.
So
yeah.
Jennifer, are you
Okay.
capturing this?
She definitely is. So we, of the
So
dates that are
Commissioner
left
Herron
there,
was May 5, 6, 12, 13, and then what was the third one,
9 and
Emma?
10.
June 9 and 10.
9 and 10. Okay, very good. Very good.
Yeah.
That's Commissioner Herron. Okay,
Commissioner Spikers, do
next.
any of those three work for you?
Yeah, 2 days. It's hard to, let's see here. I
We're
think
thinking
the 5th.
it'll be an evening time arrival and then we'll be finished hopefully early afternoon the next day.
Yeah, the 5th and 6th would be fine if I'm out of there by noon on the 6th. Otherwise, we have just planned all these different camping adventures, so I'm
5 and 6.
would that
Okay.
work for everybody? 5th and 6th?
The June one, not the May. I can't do any of the dates in May.
Yeah.
Okay. We have the June 9 and 10th. David, did you have June 9 and 10th?
I'm looking.
I believe that's going to work for me. Emma, if I lose you, I'm going to have to call you back. We're bouncing around here.
I'm sorry, I gave
June
you the
9th.
thing, so those 3 that I gave will work for me.
Yeah, 9 and 10, June 9 and 10 works for me.
Yeah.
All right, so
That
Commissioner
would work.
Herron, Commissioner Howgley, Commissioner Carter, 9 and 10 work for you?
Yeah, that will work for me too.
I would
okay.
need to line up childcare for those
Okay.
2 days, but
So tentatively.
yeah, put me down as a
Okay.
tentative.
Okay. I
Great.
think
And
we
then
are.
Commissioner Norris,
Yes, I'm here.
does
Okay.
June 9 and 10 work for you?
June 9 and 10. Yeah, I think that would be just fine.
Okay.
Okay. All right, so we will tentatively plan on that. Again, we'll do a later evening arrival so that helps free up some of the time. We'll try to be done early afternoon and we'll get that scheduled to you. And Commissioner Carter, we fully understand that childcare is hard and difficult. So thank you for your efforts with that. Okay, and we just need a final head count on hotel rooms for the Rural Leadership Conference in Chelan. And we know some of you have already replied, but we just want to get final notice because there's other hospitals that are really needing some rooms. So, and Commissioner Carter, I believe you are not able to attend at all this year. We're going to send your regrets.
Yeah, I'm sorry. I have some.
Okay.
Yep.
No worries. We
David,
just need to know.
David, you're going to be gone too, right?
Nope, I'll be there.
Oh, great. Oh, super. Okay. I thought you were going to be gone. That's perfect. And then-
Jennifer should have my yay on that.
Okay.
Yep. And
So
Commissioner
Carter is a no,
Herron,
Spikers is a
Commissioner
yes.
Herron and I are a yes.
Yes.
Okay. And Commissioner Norris, are you planning to go to Chelan this year?
Yes, that's one of my favorite things to do. So yes.
Okay. All right, so Jen, it looks like we have 4 commissioners out planned to attend. Thank you guys so much for doing that. It helps Jennifer a lot.
Thank you. And then Jennifer, I would ask that you, following this meeting tomorrow, would you push that information out to the rest of the team so that we didn't inadvertently stub our toe, so to speak, from a
Yes.
calendar perspective.
I will do that.
Thank you so much. Okay, let's see here. We are on to our next item, and this is Resolution 713-0425, and it's regarding censuring of Commissioner Norris. And so this is something that is before us, and I'm going to go ahead and ask for a motion first and then open it up for comments. With that, I'd like to see if there's a motion to approve the resolution 713-0425.
I move that we approve the resolution.
Okay, Emma? We're approving the resolution that would be Commissioner Carter. Okay, you'll second it. Okay, thank you. And with that, I'm going to go ahead and open the floor for any comments that would care to be made about this resolution.
I need to abstain from voting on this resolution.
Say that again, please, Commissioner Spikers.
I need to abstain
Yes,
from voting on this.
understood.
There are certain reasons that I can't disclose.
I understand. Thank you. Thank you very much. And I would say that this resolution. Go ahead, please.
It's clear
Hmm,
if you have time.
I
If not, I mean,
would prefer not to do
Yeah.
that in this meeting today. Thank you, Commissioner Herron.
all right.
I would care to offer the comments of Commissioner Norris. It is with great gratitude that I thank you for your years of service that you have provided to this district. And you yourself have been in this position once before as president of the board. And I thank you humbly and respectfully for your service. You are an incredible individual and you have given so much to our district, and thank you so much. But it is the time for us to move forward on this. And so I'm going to go ahead and call for the vote unless there's any additional comments. Okay, all those in favor of the motion to approve the resolution 713-0425, please signify by saying aye.
Aye.
Aye. Thank you, Commissioner Herron. Okay, so motion passes.
Oh,
Do we
you need
have
to-
any abstains? Actually,
Commissioner-
excuse me. Do we have any
Yes.
abstains?
Yeah, I did. I've already announced that.
We have announced that.
Commissioner Hadley, you have to
Spikers,
ask if there's any opposed. You asked for
any
the ayes.
opposed?
Are there any
Any
opposed?
opposed? Thank you kindly.
Commissioner Norris has not
Yes.
voted.
She has not
Pardon?
responded.
You oppose?
Did you want to cast a vote, Commissioner Norris?
Yes,
Yes, I would like to do that. I know
oppose.
to, I don't want to, I-
to oppose.
I'm getting people telling me I need to repose, but this has been really a good thing for me. And,
This isn't time for discussion.
yeah, and this is not, time for discussion. If,
Okay.
somebody
Thank
wants to talk.
Thank you, Commissioner Norris. We hear your words and we see your heart. So motion carried. Thank you very much, everybody. With
Commissioner
that,
Ugly, just for the record, I wanted to confirm, we weren't able to hear Commissioner Herron, but you confirmed that she had a positive vote, correct?
I did, yes.
Okay, great. Thank you.
You're very welcome. Thank you. With that, the next item is on the agenda is commissioner comment. With that, I'll go ahead and open it up. And Commissioner Carter, commissioner comment.
Thank you, President Hagley. That last vote was difficult. Commissioner Norris, I echo what President Hagley said, that we thank you for your years of service, in fact, your lifetime and career of service, you know, first as a nurse and then as a community advocate. So thank you for that. Otherwise, looking to be a very hopeful, beautiful spring. Looking forward to continuing hearing more good news from the hospital in the future.
Thank you, Commissioner Carter. Commissioner Herron, any commissioner comment? You're welcome.
Just a very upsetting meeting in many ways, but at the same time, there are some light ahead of the tunnel that I can see. It's been very challenging due to some of this. I feel like I'm always a casualty of
Technology.
technology, you know. I maybe have to consult with Elon Musk to help me out here. Anyway, it's been very, very difficult. It's heartbreaking. From the last our last vote, which it was just tremendously sad for me. It's a sad day, but I'm looking forward to a brighter future, and hopefully that things will all go well, and we are able to deliver what we promised to give to our constituents. That is the expansion of our and expansion of our services, and just moving forward to provide more access to healthcare from our different service areas that we have a hard time reaching out to. I thank you for all that. So anyway, again, I don't know what else to say. It's been terrible. I mean, really. I am lost for words. Sorry.
Oh,
Thank
no.
you.
Thank you, Commissioner Herron, very much. Commissioner Spikers.
Thank you. Just want to make sure that we just continue to move forward in the path that we are headed right now. I hope it is smoother than what normally is when we build a 90,000 square foot facility. But, you know, that's the way things kind of go. I just want to let the staff know I'm very glad and to have each and everybody, every employee doing a great job for us, and let them know that every one of the Board of Commissioners are trying to do our best. We all have the best heart. We've committed ourselves to doing the very best for this district, for our staff, and especially for the people that visit our hospital that need help. So hopefully that resonates to everybody that is employed with the hospital district. Thank you.
Thank you, Commissioner Spikers. Commissioner Norris, you're with us. Would you like to share anything?
Yeah, I would. It's some of it I just didn't know what to do with, and other parts of it, I did, you know, I just enjoy nursing, healthcare, all that kind of stuff is, I've had all my kids at the school, and so I just, maybe we'll see what happens next.
Very good.
Yeah.
Enjoy the beautiful evening. Yeah. Thank you, Commissioner Norris. I would echo all the comments of my colleagues this evening. The heartfelt, deeply heartfelt comments that have been shared. I have to really echo, you know, to the staff, to the team, all the hard work, and it's so rewarding for us as commissioners to be able to reward our hardworking team. And thank you very much for everything that you do every day. I also want to thank again Commissioner Norris for her incredible contribution to the district over the years and to the community. And that certainly won't stop to the community. I'm pretty confident of that. But with that being said, I wish everybody really a great, beautiful evening and a great rest of your week. And we will see you back here next month. And thank you all for your time.
Thank you, everybody. Have a
Go
good
ahead and
evening.
close the meeting.
Good night, everyone.
Thank you, Commissioner Herron, and thank you for your patience.
Thank you for your salvation.
You're welcome. We made it. We made it. Good night, everybody.
Good.
Good night.